Hi, and welcome back to my channel. My name is Danica Kopp, and I am a licensed clinical social worker in Virginia and a licensed independent clinical social worker in Massachusetts. Thanks for joining me today for Therapy Thursday. Today I was asked to speak to you about OCD. So what is OCD? A lot of people get that thrown around like, oh, you're so OCD. What it actually stands for is Obsessive Compulsive Disorder. And it is under the anxiety disorders. And OCD means that your brain really gets stuck in its thinking. So obsessive is that you really kind of just get stuck in obsessive thoughts. So you basically have this circling of your brain. And I do have my DSM here to refer to. So obsessions are a recurrent and persistent thought, impulses, or image that are experienced at some time during the disturbance as intrusive and inappropriate and cause marked anxiety and distress. So they're really pretty much out of your control. They just kind of come and they just circle and you can't stop them or control kind of where your brain goes. The second one is that the thoughts, impulses, or images are not simply excessive worries about real life problems. So this is kind of tricky in COVID because COVID is a real life problem. And so if you are kind of having obsessive thoughts about COVID, you're not necessarily having OCD, even though as a culture we want to kind of label that OCD because COVID is a real life problem. The third one is the person attempts to ignore or suppress such thoughts, impulses, or images, or to neutralize them with some other thought or action. So that, again, they're out of the person's control, that the brain just kind of takes over and makes it incredibly challenging for them to kind of control what they're thinking about. And the fourth one under obsessions is that the person recognizes that the obsessional thoughts, impulses, or images are a product of his or her own mind, as opposed to like a thought insertion, which is more of a hallucination or a delusion. So that would go under more like a schizoaffective or a bipolar with psychotic features, or it would have kind of a different take on it than just OCD. OCD is not like delusions or hallucinations in terms of what those thoughts are. So then the second part of obsession is the compulsive, and that is defined by repetitive behaviors. So for example, hand washing, ordering, check words that they silently kind of say to themselves, or mental acts, so like praying or counting or repeating words silently, that the person feels driven to perform in response to an obsession or according to rules that must be applied rigidly. And then that the behavior or mental acts are aimed at preventing or reducing distress or preventing some dreaded event or situation. However, these behaviors or mental acts are either not connected in a realistic way with what they are designed to neutralize or prevent, or are clearly excessive. So that's kind of the definition of the obsession and then the compulsion. So folks with this disorder, it's a challenging disorder to have because it requires so much brain power and so much energy to try to kind of, manage all of these thoughts or the compulsions that you're trying to use to do the thoughts. So I've worked with some clients who, they struggle with this kind of circular thinking where they get stuck on a thought about something and their brain just is stuck. No matter what they do, they just can't move their brain off, whatever their, obsessional thought is. And then I've worked with clients who have, the compulsions like the hand washing or the nightly routines that are rigid. I'm talking rigid, that like if you start your routine, you have the way that like you take off your makeup, and then the way that you wash your face, and then the toner, and then the creams you use, and then the brushing of your teeth, and then maybe getting in the shower, and then you can't get into their bed until they're completely clean, and then completely new pajamas all the time, and new towels, and like everything has to be like really clean. And if they get interrupted in that routine at any point, they have to go back and restart the entire routine. Or I have people who kind of have to touch things a certain number of times before they can kind of like actually move on. So that's kind of the compulsion. And you can see that can be really disturbing, knowing that like this is not okay, but like your brain is stuck and I have to do this, and if I don't do this, oh my God, like the worst could happen. And knowing on one level that like that's not necessarily true, but being totally unable to control that thought. It's a serious disorder. So it is really hurtful when we kind of throw around like, oh, that's so OCD, or I can be so OCD, because it is a pretty serious disorder. Now, certainly we can all have traits of OCD, and you don't have to meet a disorder, as we kind of talked about, like with anxiety. We all suffer from anxiety. It's just the level in which it intrudes upon our lives. And this is the same thing. When you're diagnosed with an OCD disorder, your life is significantly impacted by these thoughts and these obsessions. And so it's not funny. It's just not. So, okay, I'm having obsessive thoughts, whether it is about COVID or even if it's about, something else that's in your life that's kind of is more falling on the OCD spectrum of a disorder versus just kind of thoughts. Either way, the goal is to train your brain to stop. Okay, your brain wants to use well-worn paths. They're called neural pathways in your brain, and they're well-worn. I like to explain them much like when you go for a hike in the woods. When you approach woods to hike into, whether you're coming from the parking lot or like a field or your yard or a park, usually as you're walking up to the woods, you can tell where I'm supposed to walk. Like it's kind of clear. The ground tends to be a little bit more kind of, hard packed dirt. There tends to be less leaves and debris on a pathway. The branches of the brush and the trees are kind of broken back. And so it's clear, like here's the path. Your brain has that same thing. And so when you approach a woods to go for a hike, you're not going to be like, let me just skip that path and I'm going to make a whole new path. Just kind of hike through brush and debris and craziness. Like that's kind of crazy. And your brain is thinking that too. Like, why would I go down a new path? And it's really hard work and there's a lot in my way. Like I'm just going to use this well-worn path. And so with anxiety disorders and with OCD, your brain is just going to keep going to the place that it always goes because that's what it knows. You can change that. Just like you can create new paths in the woods, it's a lot of work. And so if we were going to create a new path in the woods, first of all, we would put caution tape up around the old path because we don't want to use that path. We want to get people to use the new path. And then we would get out the heavy machinery. They have major lawnmowers that clear out brush. So we would need one of those to kind of get started. And then once we're started, we would need to kind of keep using the path because the more you use that path, the more it's going to kind of become a well-worn path. Same with your brain. First time you're going to use new ideas, new coping mechanisms, it's like breaking out the heavy machinery and it's hard for your brain. However, the more you use these paths, they become well-worn paths. And guess what happens when you stop using the old path in the woods? It all grows back. Same as your brain. So that's your incentive to try to really work hard to use new skills. Okay, so what are our new skills? Well, the first thing I like to do is I personally think humor helps. So with clients, I always tell them the story of tomatoes. So I don't know if you've ever grown tomatoes, but tomatoes are a really, really hard plant to really grow. They require a lot of time and attention and energy and passion and food and water and sun, and but just enough, not too much. Too much and they don't do well either. So they're kind of finicky. But if you give them just the right amount of food and water and sun and love, guess what happens with tomato plants? You end up with a gajillion tomatoes. You're having tomato everything. And tomatoes just keep growing. And you're like, it's too many tomatoes. That's worries. The more time and attention and love and sun and water and food you feed them, the more they grow and the more they create more and more and more. And that's that well-worn path in the woods, okay? So again, we're doing the new path. So the new path means that I say to myself, stop. We need to stop. And then we need to refocus on being present in the now moment. Because some of us call it mindfulness, but it's grounding. It's basically coming outside your head and focusing on what's in your sphere. So I talked about this. Just start naming what you see. So my light, my computer monitor, my laptop, book, fan, candle, massage thing, I have pictures. And you just start naming what you see, and you just keep going until you kind of can feel yourself start to calm down. And as you start to calm down, you then have to just move forward, okay? The goal is to not get stuck back on those thoughts once you kind of get moving forward. What I'll also ask clients to do a lot of times is I want you to rate how high your anxiety is right now on a scale of 0 to 100. So 100 means, oh my gosh, like I have to do my thinking or my obsessive, action regarding my OCD, or whatever the worst thing that could happen is absolutely gonna happen. That's 100 or close to 100. And then, 0 would be I have no anxiety whatsoever. So many clients, when we start this, they're at a 90 or a 95. It's pretty bad. And so I will then say, okay, now start naming what you see. And so they'll start naming what they see. And I might also kind of, take a nice big deep breath in. So you kind of breathe in for 3 or 4, kind of hold it for 3, and then kind of breathe it out for 3 or 4. Keep naming what you see. Let's do another big breath. Keep naming. And then I'll usually ask them about, after a few minutes, okay, rate how high your anxiety is right now. Generally, it's going to have gone down. It's not going to be 0, but it might be, maybe an 85, and I'll be like, great, so it's coming down. So now let's think about other things that you can get busy doing. So let's make a list of, other tasks you can do, other ways to distract your brain that you can do, and we'll kind of look at that list and how we can use that. Another thing I'll do with OCD is that we have to kind of put worries aside, and we're going to have worry time daily. So worry time is something that it can be really effective with OCD, where you have somebody you can check in with, and you can take those worries to that time. At that time should be no more than 15 minutes a day, okay? So for 15 minutes a day, you have a check-in with somebody you trust. And you have to put your worries aside until then. So when you have that, I wonder if such and such would happen. I should probably check that because, I definitely don't know that for sure. And it's probably something that you actually do know. I have clients who get OCD, checking things with their bosses at work, where did I do that right? I don't know that I did that right. Is that how it happened? Maybe I need to check to make sure that I did that okay and that I'm doing what I need to do. And they get really stuck on those thoughts, and they really struggle professionally because of that. So, and then they check with their supervisor, and their supervisor starts to be like, yeah, no, you're fine. Yeah, I don't think you did that. But they create this whole scenario in their head, kind of going down that rabbit hole. So again, initially I will allow clients to write it down, but the goal is to not even write it down. But initially, usually the anxiety is so high that they're going to forget it, that I'm like, fine, for the first week, you can write down the worries that you're going to save for worry time. But you have to just kind of write it in the notebook, and then you need to move on because you're going to worry about that later. And then at your 15-minute check-in, ideally, you're not going to have the notebook going forward, but starting out, you can open the notebook. But what you are going to find is that at worry time, those worries aren't at the same level. You're not worried about them. And if you were to rate how high your anxiety is about them, it's not much at all. Maybe 40, 50. And in OCD, that's a really good level of worry because you're never going to reduce completely the worry, especially not without medication, and especially not initially. You are going to get better at it, but it's probably not going to you're not going to have a 0 level of anxiety if you have an anxiety disorder. It's just not possible. I myself have an anxiety disorder, and I'm never at a 0. I'm probably closer to a 10 to 20 most of the time. And again, it doesn't occupy my life. I don't get stuck on my thoughts. Most of the time. I will have some kind of circular thinking. I don't have a diagnosis of OCD, but anxiety can cause that circular thinking where you kind of get stuck on a worry. But I'm not having, kind of the compulsions and the obsessive thoughts in that way. So that's my OCD stuff. Thanks for the suggestion. This was a great topic. Certainly am open to any other topics that you want to share. Please don't forget to like, subscribe and share if you find this helpful. That shares it with more people, and I certainly am enjoying hearing from people I don't even know that they are finding these helpful. That was always my goal, was to just put some skills out there during this time and be helpful to those, because I forget that the skills that are just natural to me are not secondhand to most people, and I want to be able to share what kind of just pops into my brain. All right, take care. Happy Thursday, happy week, and I will see you next week.